This is Dr. Bill Hayden, an emergency medicine physician. As you can see, this is a pretty devastating hand injury. These injuries are also typical of what you may encounter in a primary care setting or an emergency department. Hand injuries can be intimidating. Early on as an emergency medicine resident, I really dreaded picking up a chart that had hand injury or hand laceration. That's because these injuries tended to be bloody. The anatomy was challenging and Latin expressions can be confusing. Unfortunately, you really can't avoid them, since 5 to 30% of all injuries presenting to emergency departments involve the hand. And hand trauma itself presents with such a wide variety of conditions that a commanding knowledge of hand trauma and anatomy is essential to any practicing emergency physician or anyone who is involved in primary care. Mastery of the hand's musculotendinous system can be the initial step toward clinical confidence and competence when handling hand injuries. This is part 1 of a 4-part series in mastering the musculotendinous system of the hand. The resources I used in presenting this presentation are 3. 2 are published by the American Society for Surgery of the Hand. The one is called The Hand Examination and Diagnosis, the Blue Book. The second is The Hand Primary Care of Common Problems, which is the Red Book. And then the Clinical Symposium published by SEBA, Surgical Anatomy of the Hand. The SEBA publication is particularly valuable because of the netter drawings. However, this is a difficult text to read unless you're well versed in the hand anatomy. So my suggestion is to begin with the Blue Book first, and then you can proceed on to the Red Book and the Clinical Symposium. Because this is an interactive presentation, you will need the following equipment: a latex glove and 4 markers, green, blue, red, and black. We're going to use these to create a visual presentation of the musculotendinous system of the hand as shown. So let's get started. There are 3 divisions of the musculotendinous system of the hand. The muscles of the intrinsic division has their origins and insertions within the hand itself. The muscles of the extrinsic extensors are located on the dorsal aspect of the forearm with their insertions down into the hand and wrist. The muscles of the extrinsic flexors are located on the volar aspect of the forearm with their insertions also within the hand itself. I suggest you pause this video and feel the muscles contract against resistance as you palpate the extrinsic extensors on the dorsal aspect of the forearm and palpate the muscles of the extrinsic flexors on the volar aspect of the forearm, and do this against resistance. Let's begin with the intrinsic division. Remember, the muscles of the intrinsic division have their origins and insertions within the hand itself. Now place your latex glove on your non-dominant hand and have your markers ready. With your blue marker, print the letters F, O, A, B over the hypothenar eminence as shown. You can pause the video while you do this. This next picture uses print font for clarity. This is the FOAB group over the hypothenar eminence. The F stands for flexor digiti minimi, the O stands for opponens digiti minimi, and the AB stands for abductor digiti minimi. Next, over the thenar eminence, also print the letters F, O, A, B. This should be done with your red marker. However, take note of the crossbar on the letter F, which is in blue. Again, you can pause the video while you do this. These are the muscles over the thenar eminence. The F stands for flexor pollicis brevis, the O stands for the opponens pollicis, and AB stands for the abductor pollicis brevis. Now with your blue marker, draw the number 8 in the palm of your hand. The 8 stands for the interossei muscles. The 4 dorsal, called the dab muscles, that means the dorsal interossei abduct the fingers. There are 3 palmar interossei, or called pad. The palmar adduct the fingers, and the adductor pollicis is included within this group. You can pause the video while you draw the number 8 in the palm of your hand as shown. This picture uses print font for clarity. Now with your red marker, print the letter 1 at the base of the index finger, the number 2 at the base of the middle finger, and with your blue marker, print the number 3 at the base of the 4th finger, and print the number 4 at the base of the 5th finger. Again, you can pause the video while you do this. These are the 4 lumbricals. It comes from the Latin word lumbricus, which means worm. The 4 small worm-like muscles help to flex at the metacarpophalangeal joints and help extend the interphalangeal joints. This picture uses print font for clarity. This comprises the muscles of the intrinsic group. Remember, their origins and insertions are within the hand itself. Those designated by blue are innervated by the ulnar nerve. This includes the hypothenar foab group, the 8 interossei, and the 3rd and 4th lumbricals. Those indicated by the red marker involve the median nerve. This is the 1st and 2nd lumbricals and the thenar foab. However, note that the deep head of the flexor pollicis brevis has ulnar nerve innervation. This is represented by the blue crossbar. The remaining body is innervated by the median nerve. I would take my black marker and now surround this group to indicate that these are the muscles of the intrinsic group of the musculotendinous system of the hand. You can again pause the video while you do this. Again, I've included the print font for clarity. This concludes part 1 of the 4-part series of the musculotendinous system of the hand. Part 2 will explore the extrinsic flexors. I want to give special thanks to medical students Cynthia Chalitko, Chad Fuller, and Amadou Kamara. If you would like to receive an annotated Latin glossary for the hand, send your email request to jwhaydenmd@gmail.com.